Today we are talking about the muscles of lower limb. Let's begin with the muscles of hip. In human anatomy, the muscles of the hip joint are those muscles that cause movement in the hip. Most modern anatomists define 17 of these muscles, although some additional muscles may sometimes be considered. These are often divided into 4 groups according to their orientation around the hip joint: the gluteal group, the lateral rotator group, the adductor group, and the iliopsoas group. Among the 17, some of them can also be classified as thigh muscles. So we will here talk about only 10 muscles which are included in the gluteal and the lateral rotator group. The gluteal muscles include the gluteus maximus, gluteus medius, gluteus minimus, and tensor fasciae lata. They cover the lateral surface of the ilium. The gluteus maximus, which forms most of the muscles of the buttocks, originate primarily on the ilium and sacrum and inserts on the gluteal tuberosity of the femur as well as the iliotibial tract, a tract of strong fibrous tissue that runs along the lateral thigh to the tibia and fibula. The gluteus medius and gluteus minimus originate anterior to the gluteus maximus on the ilium and both insert on the greater trochanter of the femur. The tensor fasciae lata shares its origin with the gluteus maximus at ilium and also shares the insertion at the iliotibial tract. The gluteus maximus origin: lateral posterior surface of sacrum and coccyx, gluteal surface of ilium, sacral tuberous ligament. Insertion: iliotibial tract, gluteal tuberosity of femur. Gluteus medius origin: gluteal surface of ilium between anterior and posterior gluteal lines. Insertion: lateral aspect of greater trochanter of femur. Gluteus minimus origin: gluteal surface of ilium between anterior and inferior gluteal lines. Insertion: anterior aspect of greater trochanter of femur. The last one, the tensor fasciae lata origin: outer lip of anterior iliac crest, anterior superior iliac spine. Insertion: iliotibial tract. The next is the lateral rotator group muscles, which is all 6. This group consists of the externus and internus obturator, the piriformis, the superior and inferior gemelli, and the quadratus femoris. These 6 originate at or below the acetabulum of the ilium and insert on or near the greater trochanter of the femur. Piriformis origin: anterior surface of the sacrum between the S2 and S4. Gluteal surface of ilium near posterior inferior iliac spine and sacrotuberous ligament. Insertion: apex of the greater trochanter of the femur. The piriformis muscles are the key muscles of buttocks. Obturator internus muscle origin: posterior surface of the obturator membrane, bony boundaries of the obturator foramen. Insertion: medial surface of greater trochanter of femur. Obturator externus muscle origin: anterior surface of obturator membrane, bony boundaries of obturator foramen. Insertion: trochanteric fossa of femur. Superior gemellus muscle. It could be pronunciated superior gemellus muscle. Origin, ischial spine. Insertion, medial surface of greater trochanter of femur. Inferior gemellus muscle. Origin, ischial tuberosity. Insertion, medial surface of greater trochanter of femur. Finally, quadratus femoris muscle. Origin, ischial tuberosity. Insertion, intertrochanteric crest of femur. Now we will move on to the thigh muscle. In cross-section of thigh, it is divided into 3 separate compartments divided by the fascia, each containing muscles. These compartments use the femur as an axis and are separated by tough connective tissue membrane or septa, which is the plural form of septum. Each of these compartments has its own blood and nerve supply and contains a different group of muscles. The 3 departments are the anterior fascial compartment, posterior fascial compartment, and medial fascial compartment. Anterior fascial compartment of thigh usually have extensor muscles, and posterior compartment has flexion muscle, which is called hamstring, and finally medial compartment of thigh has adductor muscle groups. Anterior compartment muscles of thigh include sartorius and the 4 muscles that comprise the quadriceps muscles: rectus femoris, vastus medialis, vastus intermedius, vastus lateralis, and with a small articularis genu muscle. Sartorius muscle. Origin, anterior superior iliac spine. Insertion, proximal end of tibia below medial condyle. Rectus femoris muscle. Origin, anterior inferior iliac spine, supra-acetabular groove. Insertion, tibial tuberosity via patellar ligament and patella. Vastus lateralis muscle. Origin, intertrochanteric line, greater trochanter, gluteal tuberosity, linea aspera of femur. Insertion, tibial tuberosity via patellar ligament, patella, and lateral condyle of tibia. Vastus intermedius muscle. Origin, anterior surface of femoral shaft. Insertion, tibial tuberosity via patellar ligament and patella. Vastus medialis muscle. Origin, intertrochanteric line, pectineal line of femur, linea aspera, medial supracondylar line of femur. Insertion, tibial tuberosity via patellar ligament, patella, and medial condyle of tibia. Finally, articularis genu muscle. Origin, anterior distal femoral shaft. Insertion, knee joint capsules. Next, we'll talk about posterior thigh muscles. Posterior compartment muscles of thigh are the hamstring muscles, which include semimembranosus, semitendinosus, and biceps femoris. Biceps femoris muscle. Origin. It has two heads. The origin of long head is ischial tuberosity and sacrotuberous ligament. The origin of short head is linea aspera of femur, lateral supracondylar line of femur. Insertion, lateral aspect of head of fibula. Semitendinosus muscle, origin. Posteromedial impression of ischial tuberosity. Insertion, proximal end of tibia below medial condyle via pes anserinus. The last one, semimembranosus muscle. Origin, superolateral impression of the ischial tuberosity. Insertion, medial condyle of tibia. The final compartment, the medial compartment, has Pectineus, adductor magnus, adductor longus, and adductor brevis, and also gracilis. Some authors include adductor minimus additionally. First, the Pectineus muscle, origin, superior pubic ramus, pectineal line of pubis. Insertion, pectineal line of femur, linea aspera of femur. Gracilis, origin, anterior body of pubis, inferior pubic ramus, ischial ramus. Insertion, medial surface of proximal tibia via pes anserinus. Adductor longus, origin, body of pubis, inferior to pubic crest and lateral to the pubic symphysis. Insertion, middle third of linea aspera of femur, medial lip. Adductor brevis, origin, anterior body of pubis, inferior pubic ramus. Insertion, linea aspera of femur, medial lip. Adductor magnus muscle, origin. It has two parts. Adductor parts has its origin at inferior pubic ramus and ischial ramus. Ischiocondylar part has its origin at ischial tuberosity. Insertion. The insertion are also divided into the parts, like origin. The adductor part, gluteal tuberosity, linea aspera medial lip, medial supracondylar line. Ischiocondylar part, adductor tubercle of femur. Finally, adductor minimus muscle, origin, inferior ramus of the pubis. Insertion, linea aspera of femur. Now we are moving on to the muscles of leg. With the popliteus muscle as the single exception, all muscles in the leg are attached to the foot and based on location can be classified into an anterior and a posterior group separated from each other by tibia, the fibula, and the interosseous membrane. In turn, these two groups can be subdivided into subgroups or layers, as the anterior group consists of the extensors and the peroneals or Fibularis, and the posterior group of superficial and a deep layer. Functionally, the muscles of the leg are either extensors, responsible for dorsiflexion of the foot, or flexors, responsible for plantar flexion. These muscles can also be classified by innervation, muscles supplied by the anterior subdivision of the plexus, and those supplied by the posterior subdivision. The leg muscles acting on foot are called extrinsic foot muscles, whilst the foot muscles located in the foot are called intrinsic muscles. Dorsiflexion, aka extension, and plantar flexion occur around the transverse axis running through the ankle joint from the tip of the medial malleolus to the tip of the lateral malleolus. Pronation, eversion, and supination occur along the oblique axis of the ankle. The anterior leg muscle. The first one is the tibialis anterior. Origin, lateral surface of tibia and interosseous membrane. Insertion, medial cuneiform, base of metatarsal bone, the first one. Next is the extensor hallucis longus muscle. Origin, middle third of the medial surface of fibula, interosseous membrane. Insertion, base of the distal phalanx of great toe. Extensor digitorum longus muscle. Origin, proximal half of the medial surface of fibula, lateral tibial condyle, interosseous membrane. Insertion, distal and middle phalanges of the second to fifth digits. The next is the posterior leg muscle. Firstly, we will talk about the superficial muscles. Gastrocnemius muscle. It has two heads. Lateral head. The origin is posterior lateral aspect of lateral condyle of the femur. Medial head has its origin at posterior surface of medial femoral condyle and popliteal surface of the femoral shaft. Insertion, posterior surface of the calcaneus. Soleus muscle. Origin, soleal line, medial border of tibia, head of fibula, posterior border of fibula. Insertion, posterior surface of the calcaneus. Plantaris muscle. Origin, lateral supracondylar line of femur, oblique popliteal ligament of knee. Insertion, posterior surface of calcaneus. These three muscles, gastrocnemius, soleus, and plantaris, are the superficial posterior leg muscles. Flexor hallucis longus muscle. Origin, distal 2/3 of posterior surface of fibula and interosseous membrane. Insertion, base of distal phalanx of great toe. Flexor digitorum longus muscle. Origin, posterior surface of tibia, inferior to soleal line. Insertion, base of distal phalanx of the second to fifth digits. And tibialis posterior muscles. Origin, posterior surface of tibia, posterior surface of fibula, and interosseous membrane. Insertion, tuberosity of navicular bone, all cuneiform bones, cuboid bones, base of metatarsal bones from second to fourth digits. These three muscles consist of tarsal tunnels, that is to say, flexor hallucis longus, flexor digitorum longus, and tibialis posterior consist of tarsal tunnel. The final one is popliteus muscle. It has no attachment to the foot bone. Origin: lateral condyle of femur, posterior horn of lateral meniscus of knee joint. Insertion: posterior surface of proximal tibia. These four muscles, that is, flexor hallucis longus, flexor digitorum longus, tibialis posterior, and popliteus muscles are deep posterior leg muscles. The next is lateral leg muscles. The first one is Fibularis longus. Origin: head of fibula, proximal 2/3 of lateral surface of fibula. Insertion: medial cuneiform bone, and the first metatarsal bone. Fibularis brevis muscle. Origin: distal 2/3 of the lateral surface of fibula. Insertion: tuberosity of the fifth metatarsal bone. Now we are going to talk about the final part, foot muscle. First, dorsal foot muscle. These muscles are intrinsic muscles of foot. Extensor hallucis brevis muscle. Origin: superolateral surface of the calcaneus bone. Insertion: proximal phalanx of great toe. The next is extensor digitorum brevis muscle. Origin: superolateral surface of calcaneus bone. Inter-osseous talocalcaneal ligament. Stem of inferior extensor retinaculum. Insertion: extensor digitorum longus tendons of toe from 2nd to 4th. Moving on to plantar foot muscles. The first layer, abductor hallucis muscle. Origin: medial process of calcaneal tuberosity. Flexor retinaculum. Plantar aponeurosis. Insertion: base of proximal phalanx of great toe. Flexor digitorum brevis muscle. Origin: medial process of calcaneal tuberosity and plantar aponeurosis. Insertion: middle phalanges of 2nd to 5th digits. Abductor digiti minimi muscle. Origin: calcaneal tuberosity and plantar aponeurosis. Insertion: base of proximal phalanx of the 5th digit and 5th metatarsal bone. Going on to second layer, quadratus plantae. Origin: medial surface of calcaneus bone and lateral process of calcaneal tuberosity. Insertion: tendon of flexor digitorum longus. Lumbrical muscle or lumbricalis. Origin: tendons of flexor digitorum longus. Insertion: medial base of proximal phalanges and extensor expansion of the 2nd to 5th digits. Third layer, we have flexor hallucis brevis muscles. It has origin at tendons of tibialis posterior, medial cuneiform, lateral cuneiform, and cuboid bone. Insertion: lateral and medial aspects of base of proximal phalanges of great toe. Adductor hallucis muscle. Origin: this muscle has two heads. The first head, oblique head, has its origin at basis at metatarsal bone from 2nd to 4th, cuboid bone, lateral cuneiform bone, and tendon of fibularis longus. On the other hand, the transverse head has its origin plantar metatarsophalangeal ligament of 3rd to 5th toes, deep transverse metatarsal ligament of 3rd to 5th toes. Insertion, lateral aspect of base of proximal phalanx of great toe. Flexor digiti minimi brevis muscle. Origin, base of 5th metatarsal bone and long plantar ligament. Insertion, base of proximal phalanx of the 5th digit. The final 4th layer. Dorsal Inter-Assay muscle. Origin, opposing side of the metatarsal bone from 1st to 5th. Insertion. First one is medial base of proximal phalanx of digit. Second to 4th, lateral bases of proximal phalanxes and extensor expansion of the 2nd to 4th digits. The final muscles of the lower limb is the plantar inter-assay muscle. This muscle has its origin at medial aspect of the 3rd to 5th metatarsal bones. Insertion, medial base of proximal phalanges and extensor expansion of the 3rd to 5th digits. Thank you for listening.